Addiction is an uncontrollable craving, seeking, and use of substances such as alcohol, nicotine, etc. Addiction is a physiological and physical inability to stop consuming a chemical, drug, activity, or substance, even though it is causing psychological and physical harm. A person who cannot stop taking a particular drug or chemical has substance dependence. Some addictions also involve activities like gambling, eating, or working. This is called behavior addiction. There are the following types of addictive drugs. Sedatives. This category of drugs slows down brain activities. Sedatives are also known as tranquilizers or depressants. These drugs are generally used to treat anxiety and sleep problems, but their regular use can lead to addiction. These drugs cause drowsiness, sleepiness, and reduce anxiety. However, these drugs also reduce heartbeat rate and breathing rate, even to the point of death if an overdose is taken. Addicts of sedatives may look drowsy, stagger, have a weak pulse, trembling hands, and lack of coordination. In severe cases, the addicts also develop thoughts of self-injury or suicide. Hallucinogens are a diverse group of drugs that alter perception, thought, and feelings. These drugs cause hallucinations, which are sensations that appear real but are created by our mind. A hallucination is an experience in which you see, hear, feel, or smell something that does not exist, usually because of illness or taking a drug. Hallucinogens can be found naturally in some plants and mushrooms or can be human-made. Addicts show both short-term and long-term effects. The short-term effects last for 6 to 12 hours and include increased heart rate, nausea, increased blood pressure, breathing rate, and body temperature, among others. Marijuana is a commonly used drug throughout the world. It is the dried, ground-up parts of the cannabis sativa and cannabis indica plant leaves, stems, flowers, and seeds. The use of marijuana brings both short-term and long-term effects. These effects include increased appetite and thirst, memory loss, lung irritation, and it may even cause lung cancer. It can also impair judgment. Marijuana belongs to the hallucinogen category of drugs, and there are many ways of using it, such as in a cigarette, cigar, or pipe. Narcotics are a type of drug that has the potential to be addictive. Therefore, such drugs should only be used according to a doctor's specific prescription. There are both legal and illegal narcotics. Some legal narcotics include codeine, fentanyl, methadone, and morphine. However, these drugs should be taken only on a doctor's prescription. The most common illegal narcotics are heroin and opium. Narcotics are strong painkillers and are often used in conjunction with other less potent painkillers like paracetamol or aspirin for patients with chronic diseases such as cancer. They are also used to relieve acute pain after operations. The commonly used narcotics are morphine and heroin. Morphine. It is a naturally occurring, highly addictive drug with pain-killing effects. This drug was named after Morpheus, the Greek god of dreams, because morphine provides a feeling of euphoria, a dreamlike state. The drug can be taken in the form of a tablet, syrup, injection, or it can be smoked. Morphine is a naturally occurring substance extracted from either the opium poppy plant or concentrated poppy straw. The general effects of morphine include euphoria, pain relief, sleepiness, drowsiness, and reduced anxiety. The symptoms of morphine overdose include slurred speech, inattention, intense drowsiness, fever, high blood pressure, swelling of the face, slow breathing, spasms, stiffness, and unconsciousness. Heroin. It is a semi-synthetic drug obtained from opium. First, the opium is converted into morphine, which is then synthesized into heroin. Its potency is increased in the laboratory by adding chemicals. The main effects of this drug include dry mouth, tiredness, nodding, and euphoria. The long-term effects include gum bleeding, inflammation, constipation, sweating, memory loss, insomnia, loss of appetite, depression, coma, severe weakness, and eventually, death. It is observed that the addicts of this drug lose everything: parents, friends, job, confidence, respect, health, and so on. Drugs addiction and associated problems. The drug addicts are not only harmful to themselves, but they are also causing harm to their family and the entire society. These negative effects of drug abuse on family and society may be explained in the following points. First, it destroys the physical health of addicts. Second, They are unable to continue their jobs and roles for the progress of society because addiction can lead to lying, stealing, excessive absence, and non-cooperative behavior. Third, addiction seriously affects mental health. Depression, anxiety, insomnia, and paranoia are all related to drug abuse. Fourth, addicts spend a huge amount of money to support the habit. On the other hand, they have no source of income and cannot work hard for earning, so they suffer severe financial crises. Fifth, the addicts have short tempers, lack patience, and decreased interest in others, and selfishness hurts their friendships. Sixth, the addicts do not take interest in family matters and important family events, leading to the destruction of family relationships. Lastly, the drug addicts are also a threat to society due to their criminal behavior, robbery, burglary, and so on. In short, addicts reflect the bad face of a society and are a hurdle in the peace, progress, and prosperity of the society. Symptoms of drug addiction. Recognizing the signs and symptoms of addiction is the first step in helping and treating the addicts. Although different drugs have different symptoms, many symptoms are common among all addicts. There are behavioral, physical, and psychological aspects of addiction. Behavioral symptoms involve the person's outward relation with the world. The behavioral symptoms include increased aggression, change in attitude and personality, lethargy or sluggish life, dramatic changes in habits, involvement in criminal activity, and loss of control in avoiding drugs. Physical symptoms relate to the body's manifestations of side effects. General physical symptoms of addiction include sudden and severe weight loss, bloodshot eyes, insomnia and anxiety, unusual body odors and breath smell, poor physical coordination, slurred speech and shaky or jerky movements of the body, and enlarged or small pupils. Psychological symptoms describe unpleasant feelings or emotions that impact the level of functioning of a person. The psychological symptoms of addiction may include lack of attention, lack of motivation, emotional and mental withdrawal from people, sudden mood swings, and anger or outbursts.